Welcome to Community EMS in New Mexico. My name is Sean Haverson. I'm the Chief Executive Officer of Emergency Services Outreach and the Center for Advanced Medical Training. This is the result of a collaboration between the Center for Advanced Medical Training, Eastern New Mexico University Roswell's EMS education program, the Emergency Medical Services Academy at University of New Mexico School of Medicine, the New Mexico EMS Bureau, the New Mexico Association of EMS Educators, and all of the work is based on the curriculum provided by the International Roundtable on Community Paramedicine. Our working definition is the use of emergency medical technicians and paramedics to augment the primary care, preventive medicine, and public health system. Community EMS is an approach utilizing existing resources to help bridge the gap and decrease barriers to healthcare at the local level within communities. There's a significant gap that exists in population and the need for affordable health care in New Mexico and existing resources and access to those resources. Emergency medical technicians and paramedics with significant experience will receive additional training to help in primary care and public health roles within their community. Community EMS workers will visit patients with barriers to access and help bridge that gap, and also utilize resources to decrease hospitalization and rehospitalization in patients with chronic illness. The expected result is better access to health care through community EMS workers, leading to healthier New Mexicans. New Mexicans living in rural parts of the state will see a decrease in the need to travel long and expensive trips to the hospital for preventive health screenings and follow-up care. There should also be a decrease in non-emergent emergency department visits and a decrease in rehospitalizations of patients who are discharged with significant medical illnesses or post-surgery. Increased health status and better access to care will be the result to the average New Mexican. The state of New Mexico and individual New Mexicans as well will see a decreased cost as healthcare costs are met in a more efficient way. Let's look at some facts that are burdening New Mexico's health system. New Mexico ranks 47th in health insurance coverage. A lack of access to health insurance coverage can be tied to negative outcomes of patients. Nearly half of New Mexicans live in an area of the state that's considered a primary care health professional shortage area, or a region that has a lack of adequate providers for their population. It's estimated that nearly 27% of the population in New Mexico is medically underserved. Unfortunately, that's more than double the national number of medically underserved Americans. It's expected that more than 250 new practitioners would be needed right now to help bridge that gap and achieve a target population to practitioner ratio. Unfortunately, in the time it would take to create those 254 new practitioners through medical school and mid-level practice, the gap will have grown. More than half of New Mexicans live in a mental health professional shortage area, which is nearly double the United States average. In addition to the current gap, we're finding that we're losing primary care physicians in New Mexico. America's Health Rankings on their website reported that there are 2 less primary care practitioners in New Mexico per 100,000 New Mexicans than was seen in each of the last 4 years. In addition, physician assistants upon graduation are generally not choosing primary care, just as their medical school counterparts are going for other specialties. Also, public health is suffering. The United States has seen a decline over 30% in its public health workforce. New Mexicans deserve better health, and we're hoping that the community paramedic augmenting the current health system would be able to help achieve this. The approach is to utilize existing resources in EMS. Emergency medical services is already existing in communities throughout New Mexico in some way. Volunteer, paid, ambulance, and fire department systems are covering rural and urban areas as we speak. EMS providers are generally trusted partners in health and safety in their local community, and most of them come from the community that they serve. The profession allows for a significant amount of flexibility in meeting local demands. The community EMS framework is designed to be as flexible as possible. The framework and the community worker will be deployed into a local community and adapt the community EMS program to meet the local community's health needs. Examples of what the EMS community worker may do include providing augmented services to clinics, public health programs, and providers of many different levels. They may also aid physicians and primary care evaluations so that patients can help recognize conditions earlier and receive treatment before it becomes an emergency. Community health workers can help adopt patients at the discretion of their primary care physician or their discharging physician at a hospital perhaps a distance away. These patients generally will have chronic diseases that require management, but the burden of traveling to the physician frequently is not realistic. In addition, they'll aid in the care of mobile patient populations that can't access health care without a great burden, both financially, time, and other reasons. Injury prevention home visits will help decrease the need for emergency services, and they'll help prevent hospitalization of patients that have been discharged using provider relationships and resourcing within the health system. Some of the conditions that have been identified through studies that are at risk for rehospitalization after discharge for chronic illness or surgeries include behavioral health, cardiovascular diseases, COPD, gastrointestinal problems and surgeries, patients with diabetes, heart failure, nutrition-related disorders. For our elderly patients, pelvic and hip fractures can be a concern. Patients with pneumonia, renal failure, and the list continues. There are some expected results. Most of them incur savings to the health system. We expect to see a decrease in emergency visits. Currently, in New Mexico, according to a study, the cost of emergency department visits for Medicaid patients alone, just the visit, not including admissions or transport, was more than $8 million per month. $8 million per month just for the visit. Based on a system that was deployed in Nova Scotia, after 5 years of community EMS present within that health system, there was a 40% emergency department visit reduction. In New Mexico, if we took just the Medicaid patients that we outlined before, that savings would total at least $41 million a year for Medicaid patients. Decreasing rehospitalizations will be important as well. Medicare patients that are rehospitalized total 2.5 million patients per year nationally, and that national strain on the budget is over $17 billion a year. Interventional studies suggest, by Jenks and his team, that 20 to 50% of all rehospitalizations are preventable. Emergency medical services, fire departments, and ambulances will see a decrease in operating expenses. Better community health will mean less emergent transports, less calls to 911. Patient education is going to decrease, hopefully, non-emergent calls to EMS, leaving the ambulance in service for true emergencies when 911 is called. The investment will be primarily in the provider and their education, and not in ongoing expenses like reorderable items. In addition, when we move a seasoned, experienced paramedic from their role in emergency medical services to community EMS, that will leave a new position that can be filled with an EMS provider who might not otherwise have a job. Community EMS has been used in programs throughout the world. Australia, England, Canada, and even Alaska have had programs that have gone on for decades. Now we're seeing this popping up throughout the United States as the focus on healthcare shifts from reactive to proactive medicine. Our project is currently in the stages of designing curriculum. In a collaboration between the Emergency Services Outreach, Eastern New Mexico University Roswell, and University of New Mexico, we're modifying the International Roundtable of Community Paramedicine to meet New Mexico's unique health landscape. There have been working groups formed in the Joint Committee on Education for EMS providers. We're also receiving support from EMS accrediting and licensing bodies. Goals that we have at the early stage and throughout include an advocate program for the use of EMS workers to help increase community health at the local level. We're working to create a flexible curriculum that can be deployed at multiple levels of emergency medical services providers and at different schools. We'd like to define the role in augmenting the current health system, essentially where community EMS workers will fit, and define a job description. To make this system a sustainable model, we do need to explore funding, billing, and reimbursement possibilities for this new line of work. New Mexico has identified 3 pilot sites for a 2013 educational deployment. Those pilot sites will be sending their experienced paramedics to the program and upon completion, they will integrate them into their health system. We also hope that in the long term, the curriculum for all initial EMS education will involve resource knowledge and public health knowledge at all levels. Through the projects, we're hoping that we can demonstrate an increased community health on the hands of the community EMS worker and a decreased global health cost through the project. As an integrated approach, we're hoping that members from this list will be able to give us their input and their knowledge on how the community EMS worker can help benefit New Mexicans. There's a few ways you can get involved. We'd like you to join our community for discussion on what community health and community EMS can be. Join our mailing list and our newsletter to stay on top of changes in community EMS. We're scheduling coalition meetings and gathering support in face-to-face meetings throughout the state. We hope that you'll put your input into our forums. Our forums are a place where you can interact and share your input. Your input is the most valuable thing that we can gain in looking towards community EMS. I thank you for your time and look forward to seeing you at our coalition meetings, on our newsletter, and in our forums.